Hello doctors, welcome back to the microbiology part. Like before attending the sessions, make sure you are having this PDF, and we have shared this PDF into your groups, into the Dr. 𝗵𝗶𝗀𝗀's channel. So you can make available this PDF, and you can, if you want, you can print and keep it. Okay, mostly whatever the PDF will be shared hereafter, it mostly will be compiled so that you can watch this video and you can annotate it as even. Okay, so again, welcome back to this microbiology part of this Game Changer series, and this is again your Dr. 𝗧𝗵𝗶𝗀. Fine. With this, we'll move on to the microbiology part. If you see about this microbiology part, there are few things you need to know. Like first, the most important one in microbiology, it is what it is the mycology part. Okay. If you don't know anything, just study microbiology and go. If you want to score good marks, you read this PDF and go. Okay. So in this PDF, we'll be having this in sequential arrangements. There will be this general microbiology, followed by this bacteriology and our important microbiology, and followed by this few images and few things about this parasitology. Okay, and the expected time for this session, it is what it is, 1 hour 45 minutes or 1 hour 30 to 1 hour 45 minutes. That is the expected time that we should complete it, and this will help your revision. And during attempting your GTs or before giving your GTs or subjective test, make sure you are reading this PDF, because most of the questions will be from this PDF. And there will be few extra questions as well that you can use your main notes to solve them up. Okay, we'll start with the first. If you see, there are different methods of sterilization. In the previous examination, the previous FMGE examination, they asked you this instrument, it is the plasma sterilization. How they asked is that what is the component you will use for this plasma sterilization? The answer was what? Hydrogen peroxide. So hydrogen peroxide. Hydrogen peroxide, right? And next, there are few more instruments which is used for this sterilization. So first, it is what it is, this hot air oven. Next one, it is this autoclave. So what is the main difference? Both of them, they will heat and do sterilization. Whereas this autoclave, what it will do, it will be sterilizing under the pressure, and it will be using the stream. Okay, it will be the wet type of sterilizations. So this dry heat sterilization, also known as hot air oven, it is mostly done under this 160 degrees Celsius for 2 hours. Okay, and what are the materials will we use? Usually our glasswares like petri dishes, our usual surgical instruments, liquid paraffins and others. Okay, so all of this glasswares and the surgical instruments, liquid paraffin, all of them, it will be sterilized by this hot air oven. And if you see, if you do sterilization itself, then you should have control, right, whether you did it correct or not. So for this control, we'll use this Clostridium tetanispos and Bacillus subtilis. So we'll keep around this. For example, you are keeping this instrument inside. I will be having a tape. I'll put them here, and I will keep inside this hot air oven. So once it exposed to this 160 Celsius for 2 hours, then what will happen is that the color of the tape, it will be changing. Sorry. Next, if you see about few more methods, like for example, pasteurization. Okay. The pasteurization, usually what we'll do for the milk. There are two methods of pasteurization, where you will hold for longer time. It is known as Holder's method. So it is done at 63 degrees Celsius for 30 minutes. अगर आपने flash एकदम से, देखिए, if you did for just 20 seconds for 72 degrees Celsius, and you are exposing them into the cold. Okay, you are exposing them into the cold, or you are cooling it to 13 degrees Celsius. So we were like cooling like a flash, like for 20 seconds, and you were rapidly cooling into 13 degrees Celsius. So it is what? It is this flash method. Okay, it is the flash method. Next, about few more methods, which is this inspissation and tyndallization. Inspissation, it is done at 80 to 85 degrees Celsius. Inspissation, it is done at 80 to 85 degrees Celsius. And remember, it is done for 30 minutes for 3 consecutive days. For example, you did on Tuesday at 2 p.m. for 30 minutes, and next tomorrow you do at Wednesday 30 minutes at 2 p.m. for the same for 30 minutes. So the same you will do for one more time. So it is the inspissation. Whereas tyndallization, it is the 100 degree, ठीक है, 100 degree Celsius for 20 minutes और 3 दिन के लिए. So 100 degree Celsius for 20 minutes and for 3 days. Fine. And next one is with the moist heat. So all of them, like if you see this dry heat, it is what? It is this hot air oven. Or this moist heat, which means the stream, like you will heat up the water how is your idli is making, right? You will stream it. Your momos, how it is making, right? Likewise, the same will be in autoclave. Okay, the same will be in autoclave. Like there will be water and there will be a streams. The stream will come and start sterilize. And usually this streams there will be under pressure. Okay, there will be under pressure like you during the examination one. So there will be, it will be done at a temperature of 121 degrees Celsius for 15 minutes. Remember, it is for 15 minutes and 15 psi. 121, 15 minutes, 15 psi. Whereas this dry heat 160 degrees Celsius for 2 hours. Pasteurization, it is hold it for longer. So 63 degrees Celsius for 30 minutes. Flash method 72 degrees Celsius for 20 seconds followed by cooling into 13 degrees Celsius. So this is the thing. Whereas if you use this moist like autoclave, this is like pressure cooker. Okay, if you use this autoclave, mostly it will kill all of the organisms. But to kill this prions, which is most smallest and antigenic particle, there you need to expose them for 134 degrees Celsius for 1 to 1.5 hours. Remember, it is 1 to 1.5 hours for killing of prions. Remember, बस इतना याद रखो. ठीक है, so dry heat, then pasteurization, then crystallization, inspissation, followed by this moist heat, which is this autoclaving, and this one, which is this plasma sterilization. Plasma sterilization uses this plasma, and this plasma will be generated from this hydrogen peroxide. Hydrogen peroxide. बस इतना याद रखो. Then we use some controls, like I told you, right? We need to check them. So we use them controls, like for example, for autoclave, we'll use this bacillus, which is known as 𝗲𝗵𝗶𝘀𝗀𝗀𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃𝗏𝗃 हॉट एयर एवन के लिए हम यूज करेंगे द क्लोस्ट्रिडियम टोटनी एंड बेसिलस सबटिलिस, क्लोस्ट्रिडियम टोटनी एंड बेसिलस सबटिलिस यूज करेंगे. फिर उसके बाद फॉर आयनाइजिंग रेडिएशन, so there will be few things, like for example if you see the single usage syringe, okay, you cannot put them into very hot, right? They are made up of plastics, they will become weak. So in such conditions we'll use this ionizing radiations like X-rays and gamma rays. So in such cases what we'll do, we'll use a control which is this radiation. Remember, it is a radiation, so make this R and cut this one, it is the P, so it is the Pt-Melis, okay, Bacillus pumilus. Next one, this is the ethylene oxide. So somewhere you use this, for example you are sterilizing the OT or a big instrument, there you will use this ethylene oxide. So there you will use what, there you will use this ethylene oxide. So gas, these are ethylene oxide, it is a gas. अगर आप गैस को यूज कर रहे हो, so it is what the control you will use, it is the Bacillus globigi, Bacillus globigi and Bacillus subtilis, Bacillus globigi and Bacillus subtilis. Fine. And can anyone tell me what is the temperature you will use in a case of usual autoclave? What is the temperature you will use? It is what? It is the 121 degrees Celsius for how many minutes? It is for 15 minutes. Under how many psi? It is for 15 minutes and 15 psi. Don't get confused. Okay. For prions will use 134. Okay. It is in certain situations. Because usually we'll do at 121 degrees Celsius for 15 minutes under pressure, which is this 15 psi. ठीक है, इतने याद रखो. फिर उसके बाद आगे बढ़ते हैं. There are few methods of this bacterial transference of this resistance. कैसे ट्रांसफर होता है? एक for something it will take from its own. So if it is taking from its own, okay, so it is known as transformation. From the environment, if it is taking by own, it is known as transformation. Or if you are using a vector, it is delivering something. Okay, you are using Blinkit and Zep2. So if you are using it and delivering, so using this bacteriophage, okay, it is what it is transduction. It is known as transduction. Next, if you are using this 𝗧𝗵𝗶𝘀, then it is the conjugation. If you are using the 𝗧𝗵𝗀, it is this conjugation. Next, if you are using this electrical shock, इसको बोलते हैं transfection. Okay, transfection. So इतना याद रखो. Transformation, it will take up from this environment. Transduction, remember this duction, it is the most important point. It is the usage of this bacteriophage. It is used by this bacteriophage. Then conjugation, you will use this conjugation pile. Okay, using this conjugation pile. So remember this, all of the methods. फिर इसके बाद आगे बढ़ते हैं bacterial growth का. Usually, like bacterial growth, it is also like us. Usually, we don't know any content. Then what we'll do? We'll start increasing. Okay, we'll start multiplying. We'll start purchasing the nodes. ठीक है, पहले हम क्या करेंगे? Nodes का count बढ़ाएंगे. ठीक है, nodes का count. अभी तक हमने पढ़ाई नहीं किया. ठीक है, rest. Initially, it will be resting, which is known as what? Lag phase. Lag phase में हम कुछ नहीं कर रहे हैं, हम बस मजा ले रहे हैं. फिर उसके बाद then this is the log phase. So lag है. फिर उसके बाद क्या हुआ? Log हुआ. फिर उसके बाद स्टेशनरी, फिर उसके बाद डिक्लाइन. ठीक है, तो देखो, so in initial phase, the lag phase, you are not studying. Okay, you don't have a notes itself. There is some point you thought like, okay, I need to study now. Then what you do, you start collecting the notes. So here if you see, there is an increase in number of living bacteria, which is seen in a case of log phase. फिर उसके बाद जैसे आपने notes count किया, फिर उसके बाद क्या करना, आपको पढ़ना चाहिए. तो when you start reading, you will be flat. क्योंकि पढ़ेगा, भूलेगा, you will read this thing, but you will tend to forget. You will read, it will tend to forget. So likewise, it will be a stationary phase. So, but you know, with this reading and forgetting, likewise only you will clear your examination. Okay, you will clear your examination. Okay, you will clear your examination. फिर उसके बाद हमें क्या करना है, हमें भूल जाना है. So there are three phases: lag phase, log phase, stationary phase, and this phase of decline. So initially there will be no increase in number. Then followed by this, there is a log phase where there is an increase in number. Okay, then stationary phase, there will be a stagnant of this number because there will be living bacilli, and this dying bacilli, it will become at a normal level. And one phenomena which takes place at this stationary phase, it is what? It is this spore formation and antibiotic synthesis. Antibiotic synthesis happens in this stationary phase, and following which there is this death of this most of the bacilli because they will become toxic and it will be died. So it is known as what? Phase of decline. So you will read, you will forget, you will remember, and you will forget. That's it. Okay, and you will pass the examination. Next, about this culture media, like if you can just write this culture media into your sticky notes and stick to your wall or stick to your library table. That will be more helpful than anything else in the world. Okay, fine. If you see this first one, it is Mycobacterium tuberculosis. We know Mycobacterium tuberculosis will use this media which is known as LG media, and recently we'll use some more advanced media which is known as what? Bactec media. They are rapid medias, like like it will give your reports within few hours. Okay, few hours instead of days. Next one, if you see this Staph aureus, the media which is used for this Staph aureus, it is the mannitol salt agar. So MSA. So it is this mannitol salt agar for this SA which is Staph aureus. Okay, then the Streptococcus pyogenes, it will use this blood agar because हमें पता है कि Streptococcus pyogenes क्या है? It is a group A beta hemolytic Streptococcus. अगर beta hemolytic है, if it can break a blood, then which media will give them? Will give them the blood media. So we'll use them crystal violet blood agar. Then if you want to transport this pyogenes, we'll use this medium which is known as Pike's media. Then if you see about this next bacteria which is this Neisseria meningitidis. So Neisseria meningitidis will use this medium which is known as ثير-Martin medium. And for Corynebacterium, like Corynebacterium diphtheriae, okay, we need to do two things. Corynebacterium diphtheriae patients, it will be presenting with this pseudomembrane bull neck, and you need to do two things. You need to make a clinical diagnosis, followed by which you need to make a rapid diagnosis, and you need to make a confirmed diagnosis. To make any rapid diagnosis, like a water, it should flow. So to use in a case of rapid diagnosis, we'll use watery medium. Okay, that is this low flush serum slope, which is used for this early diagnosis. Whereas to confirm the diagnosis, we'll use this potassium telluride agar. So remember, Corynebacterium diphtheriae, low flush serum slope and potassium telluride agar. Low flush serum slope and potassium telluride agar. Staph aureus, SA, so MSA, mannitol salt agar. Streptococcus pyogenes, it breaks the blood. So it is what? It is this blood agar, which is this crystal violet blood agar. Okay, Neisseria meningitidis, it is what? ثير-Martin medium. And for Bacillus cereus, you just remember two mnemonic, which is 𝗵𝗵𝗶𝘀. So these are the two media which is used for this Bacillus cereus. Next, Clostridium. Remember, Clostridium, C for C, it is used for CCFA. Okay, cefoxitin, cycloserine, fructose agar. Okay, that is Clostridium one. Clostridium, it is CCFA. Next, Bacillus anthrax. It is a plate. Okay, I'll tell you one mnemonic for it also. It is the Bacillus anthrax, it is the plate. Remember, it is a plate. So Bacillus anthrax, it is the plate medium we'll use. Then Shigella will use Shigella and Salmonella agar, DCA and XLD. So all of this agar will use for Shigella. For Salmonella, we'll use this Wilson and Blair medium. Okay, Okay, then about influenza, okay, we'll use this Fields agar with Leventhal medium. And for Vibrio cholera, Vibrio cholera will use this 𝗚𝐶𝐵S medium, and as for the transport of this Vibrio cholera stools, we'll use this medium which is known as VR medium, also known as Carey-Blair medium. Then Bordetella. So for Bordetella, we'll use this same B for B, Bord. Okay, we'll use this Bordetella medium. Okay, Bordetella medium. Next for Pseudomonas, we'll use this Cetrimide agar, where it will show out pigments. Then for brucellosis, we'll use this Castaneda medium. Okay, Castaneda medium, it is like this. It will be having both components. It will be liquid and it will be having the solid. So it is this Brucella. It is the Brucella medium, which is this Castaneda medium. Then for Campylobacter, we'll use this agar, which is known as Scirrhous agar. For Leptospira, it is this FMGE medium. So can anyone tell me what is the name of the disease which is being caused by this Leptospira? It is also known as Weil's disease, which is the leptospirosis. Yeah guys, it is the leptospirosis, also known as Weil's disease, which is spread due to the rat urine during the flood. Yeah. Then if you see next, this is this Legionella pneumonia. Remember Legionella. So Legionella, it causes this atypical pneumonia like diarrhea along with this pneumonia. So we'll use this Bice medium. Okay, it will use this Bice. We'll use this Bice medium, remember. And what are the Bogdorferi will use this BSK medium. Bogdorferi will use this BSK medium. Yeah, it produces this atypical pneumonia. Next, Leishmania will use this triple N medium. Okay, we know this Leishmania donavani, it causes what? Leishmania donavani causes Kala Azar. Okay, remember. Next, about this few antigens and few tests. If you see the first one, it is known as superantigens. Usually, the T cell, it will get info from this MHC2. Like there are, like we know, like if it is CD4 type of T cells, it will get from this MHC2. If it is CD8, then it will be get from this MHC1. Okay, so we know this mnemonic. At end, it should be 8. So if it is 4 into 2, it should be 8. 8 into 1, it should be 8. Okay, so it is what it is usually. So MHC2 type of antigen presenting cells, वो क्या करेगा? It will present this antigen ले लो करके it will give to this T cell. Whereas in some special situations, it won't give just this antigen. Okay, whereas before binding to this antigen, this super antigen वो gap को fill करेगा. ठीक है? Okay, it will fill up this gap. ठीक है? So it will fill up this gap. So it is what it is, the super antigen. Means without even presenting to the antigen, the body will start reacting. Okay, it is known as what? It is known as super antigen. So which of the following means diseases will be having this super antigens? The usual route क्या है? मतलब usual route it is giving this from MHC to here, but whereas there is small component which is coming in between and stimulating the cell. So it is what it is, the super antigen. So this will be seen in a case of toxic shock syndrome, in a case of Staph aureus, toxic shock syndrome in a case of Staph aureus. Then streptococcal pyogenic means pyrogen. I told you, it means pyrogen means the fever causing exotoxin. It is by the Streptococcus pyogenes. Then CMV and EBV also causes the super antigen, and the fungus Neisseria furfur, it also has this one. And Streptococcus pyogenes, which is having one more toxin, which is erythrogenic toxin. It is also a super antigen. So just remember the main one, it is this toxic shock syndrome. Okay, and another one is this pyrogen exotoxin and Neisseria furfur, CMV and EBV. Okay. Then about a few heterotropic antigen tests. For example, what is heterotropic antigen? Okay, heterotropic antigen means there is antigen mismatch. Okay, there is antigen mismatch. Okay, so instead of recognizing as this antigen, like it is recognized as this antigen. So for example, instead of it is used for diagnosis of X disease, but this X disease antigen, it is looks similar to this disease of X dash. So this same antigen can be used for the diagnosis of this X dash disease. So we don't need to synthesize new antibodies for it. So that's why it is what it is, this a heterophilic antigen. The antigens are a bit different, but the antibodies thinks it is same. So it will synthesize same type of antibodies. So one of them, it is what it is, this 𝗵𝗵𝗀𝗀 reaction. So remember this 𝗵𝗵𝗀𝗀𝗀 reaction. It is for diagnosis of this rickettsial infection. So remember it is 𝗵 for rickets. 𝗵𝗵𝗀𝗀𝗀𝗃 reaction for this rickettsial infection. Then Paul Bunel. Remember Paul is a mono guy, a single guy. So remember Paul Bunel test is used for this infectious mononucleosis, also known as क्या? What is the other name of infectious mononucleosis? Yeah guys, it is what it is known as Hissing's disease, and we know this infectious mononucleosis, it will caused by this Epstein-Barr virus. And next, if you see this cold agglutination test, a few tests you need to know. Cat, mat, sat. Okay, cat, mat, sat. Cat, sat on mat. Okay, so remember it is cat, sat on mat. Okay, okay. See, then there are few tests like neutralization test and agglutination reaction. So neutralization test means like to neutralize its antigens. We'll use this test which is known as Schick test. Like for example, if the child is susceptible to diphtheria or not. Okay, whether the child is susceptible to diphtheria or not. So in such cases, we'll do a test which is known as Schick test. If that Schick test becomes positive, then the child is susceptible to the diphtheria. Okay, if the child is susceptible to the diphtheria, then we should vaccinate them. Okay, then if you see this Naegler's reaction, then it is what? Naegler's reaction, it is seen in a case of Clostridium perfringens. I will show this Naegler's reaction soon. Then about this agglutination antigen means here the antigen plus antibody, they will make a complex. Okay, this includes our Wiedal test which we use for our typhoid fever. Then see CAT, which is this cold agglutination test which is used for this mycoplasma. Okay, we already saw, right, where in a case of autoimmune hemolytic anemia, there are two hemolytic anemia. Garam wala, warm wala, which is IgG wala, okay, which is seen in a case of CLL, whereas in a case of Thanda wala, which is cold autoimmune hemolytic anemia. Okay, remember it is the same cold. So remember it is what? C, cold agglutination test, it is the mycoplasma, the same. Okay, then about the standard agglutination test, it will be done in a case of Brucella. So Brucella, that is the standard agglutination test. Can anyone tell me what is the name of the media we'll use for brucellosis? What is the name of the media we'll use for this Brucella? See guys, for brucellosis I told you, for Brucella we'll use this medium which is known as Castaneda medium. Which is known as what? Which is known as Castaneda medium. So likewise they will ask you in the questions, very random questions they will ask in the examination. So make sure you are remembering it. Next for this microscopic agglutination test will be seen in a case of Leptospira, and we know Leptospira, it is what? It is the Wales disease. And what is the media we'll use for this leptospirosis? See, the media we'll use for this leptospirosis, it is this EMJH media. It is this EMJH media. We'll use this EMJH media. Fine. A good Dr. 𝗏𝗏 and Shahnawaz. Fine. Then we'll move on to this final part, which is this bacterial toxins. There will be around one question in each alternate exams, or even one questions in each NEET PG or FMGE examinations. Fine. If you see the first one, it is what? It is this elongation factor. It is the elongation factor 2. This is a protein synthesis inhibitor. Remember, it is elongation factor 2. So whatever the disease or whatever the organisms, unke naam pe ye 2 hoga. Okay, there will be this names contained into this organism which causes this protein synthesis inhibition. This include first one, okay, diphtheria. Dip का मतलब कितना है? Dip का मतलब die. So it is die. So it inhibits elongation factor 2. It's Pseudomonas. So it is Pseudomonas. So do matlab it is 2. So 2 Pseudomonas and diphtheria, it will inhibit this elongation factor 2. फिर उसके बाद आते हैं 60S. Remember this 60S ribosome. S for S, that will be seen in a case of Shigella. And the Shigella like intro is this EHEC. EHEC also will be having this type of protein synthesis incubation. So Shigella and EHEC will be having incubations to this by 60S ribosomal protein incubation. फिर उसके बाद आते हैं neurotoxins. There are 2 neurotoxins you have to remember of. One is this Clostridium tetani and Clostridium botulism. Okay, you know this Clostridium tetani will incubate the release of GABA and glycine. If you see these neurotoxins, the Clostridium tetani, it will incubate this gamma and glycine. Whereas this Clostridium botulism, it causes this incubate the release of acetylcholine. We know this GABA and glycine, they are this inhibitory neurotransmitters. That's why this neurotoxins in tetani, they will be having this lot of spasms. Whereas in the case of Clostridium botulism, the child will be very much flaccid in nature. So what it will be, because there will be no contraction, because there will be no acetylcholine release. Fine. Remember. Next about this CAMP inducers. Remember this CAMP as a mnemonic. So C for cholera, A for anthrax, C for cholera, A for anthrax, and remember this split or make this M into E. So it is what? It is the ETEC. Next one, this for P, it is the pertussis. So it is the pertussis. Yeah. In the case of botulism, it will cause this flaccid paralysis, whereas tetanus causes this spastic palsy. Okay, remember. And next about this cytokines. Okay, cytotoxins, it includes this Staph aureus and Clostridium perfringens. Okay, mostly they won't ask about this cytotoxins, whereas they will ask you about this CAMP1, about this EF21. These are the most important one in this most important ones. Fine. Yeah, we'll move ahead with this first part, which is this Staphylococcus and Streptococcus. If we see about this Staphylococcus, like the Staphylococcus, it will be positive for this both catalase and coagulase. The Staphylococcus will be positive for this both catalase and coagulase positive, and we know it is a normal flora in the nose. Okay, he asked in the recent in the examination which of the following is the normal flora. It is one of the Staphylococcus which they have been asked. Okay, and we know if there is any, if it is normal flora and whatever the infection around the skin, okay, it is the most common cause. So it is the most common cause for skin and soft tissue infections, and it is also the most common cause for this acute endocarditis and acute osteomyelitis. Acute endocarditis and acute osteomyelitis. And what are the virulence factor? Like how, with which it will cause disease? It includes this protein A and this leukocidin. Protein A and leukocidin. Protein A and leukocidin. Just remember this two virulence factor for sure. Then if you are able to see, they will give this image and they will ask you whether this organism is gram positive or gram negative. What will be your answer? Whether this organism is gram positive or gram negative. It is the organism, it is what it is, blue in color. Okay, it is blue in color or around this purple in color. So it is what it is, gram positive in nature. It is gram positive. It is gram positive. Okay, and if it is in this type of grapes cluster, so it is what it is, this Staphylococcus. Yeah, good, Dr. Diana. Okay, then I told you what is the agar which used for this Staphylococcus? SA, remember us, MSA. So it is what is this, mannitol. Staphylococcus, remember us, MSA. It is the mannitol salt agar. So it is what it is, this mannitol salt agar. Fine. Then फिर उसके बाद आगे बढ़ते हैं. There are few toxins which are being released from the Staphylococcus aureus. This include this enterotoxin causing this food poisoning, toxic shock syndrome, and Staphylococcus scalded skin syndrome. Staphylococcal scalded skin syndrome, which is caused by this exfoliative toxin or epidermolytic toxin. So these are the toxins. This include food poisoning toxin, toxic shock syndrome toxin, and staphylococcal scalded skin syndrome toxin, and this exfoliative or epidermolytic toxin. Fine. And diagnosis, I told you, we'll use this mannitol salt agar, where it will produce this golden yellow colonies. So we told it is aureus. Aureus means gold. So it produces this golden yellow colonies. And the selective media is what it is, mannitol salt agar. Okay. And if there is any resistance to this, it is due to the resistance over this change in the gene, which is this 𝗵𝗆 gene. It is due to the change in the 𝗵𝗆 gene. Yeah, it is the 𝗵𝗆 gene. Next, about this Streptococcus pneumoniae. If you see this Streptococcus pneumoniae, it is occurs in pairs. It is known as what? It is known as Diplococci. Okay, you can see, right? 1, 2, 1, 2, 1, 2. So it is occurs in a Diplococci, and remember, it is what it is, capsulated. It is capsulated. It is Diplococci and it is capsulated. And we know this name is itself, it is Streptococcus pneumonia. What it will cause? Obviously, it will cause lobar pneumonia, and it is the most common cause of meningitis and for this otitis media as well. And on cultivation, it will produce this carom coin colonies. It produces this carom coin colonies on blood agar. And then we need to split them, this Streptococcus, into different parts. This Streptococcus pneumoniae will come under this alpha hemolytic Streptococcus. Will come under this alpha hemolytic. Whereas there are two beta hemolytics. One is this Streptococcus pyogenes and another one is this Streptococcus agalactiae. One is this Streptococcus pyogenes and another one is Streptococcus agalactiae. So, but how will you differentiate? We'll differentiate based on their group. We'll differentiate as group A beta hemolytic and group B hemolytic. So, group A beta hemolytic Streptococcus, it is what it is, this Streptococcus pyogenes. It is Streptococcus pyogenes. And how will you group? It is based on this sensitivity, which is known as what? Bacitracin. So, bacitracin sensitivity, you will separate them into group A and group B. Okay, and they will be test positive for a test which is known as PYR positive. And what are the tests which is being caused, or the disease which is being caused by the Streptococcus pneumoniae, Streptococcus pyogenes? It is what it is, this erythrogenic toxins which causes this pharyngitis, skin and soft tissue infections. And we know it causes one fatal disease. It is what is this, acute rheumatic fever, and in long run it can cause this PSGN. So there will be a history of, there is a child who has had a sore throat 14 days back. Now he is presenting with features of some murmur. which is due to this mitral regurgitation. So what will be the diagnosis? It is what? It is this acute rheumatic heart disease. Okay, previously it should be acute rheumatic fever followed by this acute rheumatic heart disease. And if there is any cola color urine or cola color urine in a case of child with a history of 14 days previous infection, so it is what? It is this post-streptococcal glomerulonephritis. So it is Streptococcus pyogenes which causes pharyngitis, which is leading to this rheumatic fever, rheumatic heart disease, and post-streptococcal glomerulonephritis. Okay, and as I told you, it will be a beta hemolytics. So what we'll use? We'll use this crystal violet blood agar as a selective media. Okay, and for transporting this, we'll use this media which is known as what? Which is known as spikes media. Okay, so we'll use for diagnosis, we'll use this crystal violet blood agar, and for transporting we'll use spikes media. And we know, is this gram-positive organism or gram-negative organism? It is in purple color. It is in purple color. So it is what? It is purple peoples. They are what? They are positive people. So gram-positive. So it is purple in color. फिर आगे बढ़ते हैं. Next we'll move on to this disease, which is this. Then we'll move on to this next disease, which is this Bacillus anthrax. This Bacillus anthrax patients will be having this typical history. Either there will be formation of this 𝗧𝗵𝗶𝘀. Along with this history, either they will be exposed to the animals, okay, or they will be exposed to the wolves, okay. They will be exposed to this wolves, which is this pulmonary anthrax, okay. And it is what? It is this gram-positive, and it is a spore-forming organism, and it is having the central spore, which looks like a bamboo stick. Okay, remember, this looks like a bamboo stick. So remember, just recently the Halloween went, right? So remember, there is a child who want to dress like a witch. Okay, it is WITCH, witch. Okay, a witch. Obviously, witch means it is a old ditch female, right? So she'll be having this clumsy hair. She'll be having what? She'll be having the clumsy hair. She'll be having the clumsy hair, which is looking like a Medusa head, means like a snake's head. So she'll be having what? She'll be having a Medusa head, and followed by which she is old age, as I told you, she needs some sticks for the support. Okay, so she needs some stick, which is this bamboo sticks. And if you see she is witch, she need to tell some mantras. Okay, mantras. So she will tell some mantras by this beads. So she'll be having this string of beads or string of pearls. Okay, and as it is a small child just dressed for this, she'll be having its long gown. Okay, it's like a tree, so it will be showing this inverted fir tree appearance, and obviously she is doing for this fun and chocolates, right? Where she will collect the chocolates, she'll be having a plate to collect it. So the media which we use, it is this blood media. Okay, remember, so she'll be having this Medusa head, so Medusa head colonies, and she will be able to see this appearance, which is known as inverted fir tree appearance, also known as Christmas tree appearance, which is on this gelatin strap. And on penicillin agar, she will be able to see the string of pearls appearance, which she is holding. And then this selective media will use with the plate media to collect the chocolates. Should be having a plate or cup, right? So it is what it is, this plate media. Then there will be this central pores, which is looking like a bamboo stick. Okay, and there are two anthrax, as I told you. There is this cutaneous anthrax and pulmonary anthrax. Cutaneous anthrax, they will tell this is this hide porter. So there is this worker who is carrying this hides of this organisms, or carrying this organism on the shoulder, and now presents with this 𝗧𝗵𝗶𝘀. So it is what it is, cutaneous anthrax. Because pulmonary anthrax is wool charter, means they are working in this wool industry and having this pulmonary like pneumonia features. It is what it is, this pulmonary anthrax. Next, if you see, if there is any toxin generated, we will use this drug which is known as 𝗧𝗵𝗶𝘀, which is used to neutralize this anthrax toxin. Fine. Next, if you see about this Listeria, remember Listeria, it will be using this L and T. Remember, it shows this tumbling motility. Tumbling motility will be seen in a case of Listeria. Okay. Then, what is this tumbling motility? Means it will be motile at 25 degrees Celsius, whereas it became non-motile at 37 degrees Celsius. They will give this and they will ask you at which temperature this Listeria will show this tumbling motility. It is what it is, 25 degrees Celsius. And what is the thing? What is the agar you will use for this? You will use this Palcam agar. Okay. Then about this gram-negative infections. Okay. there will be these few differentiating factors in the meningitis. In meningitis, there will be the classical features of headache, there will be photophobia. They will give the history. There is a history of headache, photophobia, and there is this phonophobia. On evaluation, you will be able to see this presence of neck stiffness. Okay, neck stiffness. Okay, and they only will tell he is diagnosed with meningitis. Okay, and on evaluation, you will be able to see this gram-positive organism or gram-negative organism. This is where the diagnosis turns the part. If you are able to see these gram-negative organisms, then you will think of two organisms. One is this Neisseria meningitis, and the another one is the Haemophilus influenza. Haemophilus influenza. Whereas if you just given gram-positive one, then if just this gram-positive one, then it is what? Then that is the Streptococcus pneumonia, I will think. So if the history given of meningitis and there is this along with this gram-negative bacilli and the presence of rash, this rash will be present in a case of Neisseria meningitis. Okay, it is a gram-negative capsulated organisms, and because it is negative, it secretes endotoxin. Okay, and it is be presented with this nuchal rigidity and the typical feature of rash, and it will cause one complication in the adrenal gland. Remember this Neisseria, it always produces some complications, whereas this Neisseria meningitis, it causes meningitis along with complication in the adrenal gland. Okay, it is what it is known as Frederickson syndrome. Okay, it is known as Frederickson syndrome, which is what? Which is this adrenal crisis. Adrenal crisis. And as a selective media, it will use this Thayer-Martin medium. Okay, Thayer-Martin medium. Okay, and it ferments. It is just meningitis. Okay, it is just meningitis. So it will ferments both mannitol and glucose. So remember, it is M also there, G also there. It ferments mannitol and glucose. Okay, remember. And we can make vaccine against this capsule. We can make vaccine against this capsule. Okay, and it will be most prevalently seen in a case of patients who is presenting with deficiency of MAC. We know in a case of complement pathway, there is one thing which is known as MAC, which creates pore and destroy. These are also known as membrane attack complex, which is formed by which components? It will be formed by C5b2c9. Okay, it is formed from this C5b2c9, and if there is any deficiency of this complements, this leads to this. This leads to what? This leads to what? This leads to this Neisseria meningitis inflammation. Okay, Neisseria meningitis inflammation. Next, if you see this Neisseria gonorrhea. So in a case of Neisseria gonorrhea, if you see this Neisseria gonorrhea, it will be having this kidney shape, and it also will be what? It also will be gram-negative, having this outer membrane proteins. So gram-negative along with this outer membrane proteins. But see, this is only G. There is no M. So it will what? It will ferment just glucose. It won't ferment. It won't ferment what? It won't ferment this mannitol. Okay. I guess things are clear. Then if you see, it will cause what? It will cause urethritis. I told this Neisseria types, they will cause infection. So Neisseria meningitis, it causes infection in meninges, and it causes complication in the adrenal gland, which is what? Which is this Waterhouse-Friderichsen syndrome. Okay. Whereas in a case of Neisseria gonorrhea, what it will do? It will do this urethritis, and it will cause complications around the liver, which is known as what? Which is known as Fitzhugh-Curtis syndrome. Okay, it causes this perihepatic adhesions. It is known as Fitzhugh-Curtis syndrome. Okay, then finally, if you see this complication, it can lead to this perineum, which is known as Watercan perineum, which causes this fistulae and sinuses in the urethra. Because it causes urethritis, it causes this Watercan perineum. It causes one more complication or one more syndrome around this liver, where there is this perihepatic adhesions showing this violin string appearance. Violin string appearance. It is known as what? It is known as Fitzhugh-Curtis syndrome. It is known as Fitzhugh-Curtis syndrome. Next, it is the Haemophilus influenza. It is the Haemophilus influenza. As I told you, the same Neisseria, they will use the Thayer-Martin media, and the transport media it will use, it is the Stewart's media and Ames media. You will use what? You will use the Stewart's media and Ames media. So Stewart's media and Ames media as a transport media you will use for Neisseria gonorrhea. Where you will use this Pike's media as a transport media, guys? Where you will use this Pike's media? We will use in the case of Streptococcus pyogenes. Good. Then where you will use this caribulary media or VR media as a transport media? You will use in a case of, you will use in a case of which disease? You will use in a case of Vibrio cholerae. You will use in a case of Vibrio cholerae. Good Dr. Anjali, good Dr. Harsh, good Dr. Parul. Good, well. Then as I told you, Haemophilus influenza, it is also a gram-negative organism, and along with this there is a presence of capsule, and it will show a phenomena which is known as what? Which is known as satellitism. Which is known as what? Satellitism. So see, this is the growth of this colony, which is this Staph aureus, and it would grow in the center. It will grow adjacent to the Staph aureus. So it is known as this phenomena which is known as satellitism. It is known as satellitism. Okay, okay. इसके बाद आगे बढ़ते हैं. Next, about the next disease, which is this typhoid. Typhoid, we know it is caused by this Salmonella typhi and some other variants like Salmonella typhi A and B. Sometimes it causes also. The features include this step ladder pyrexia along with the features of rose spots and relative bradycardia. In the previous FMGE examination, they asked where you will see this relative bradycardia. In typhoid, we'll see. In brucellosis also, we'll see this relative bradycardia. Yaad rakho. Then, about diagnosis of this typhoid, they will ask you, in first week, what you will do? See, in first week, we'll do the blood culture. So, you can remember BASO. Okay. So, first week, we'll do blood culture. Second week, we'll do this agglutination test, which is this Wiedal test. And third week, we'll do this stool culture. And fourth week, we'll do the urine culture. So, first week, it is BASO. First week, we'll do this blood culture. Second week, we'll do what? Agglutination test, which is this Wiedal test. Third week, we'll do the stool culture. And fourth week, we'll do the what? We'll do the urine culture. And for this typhoid, we'll use this media. What is the name of this media? That is what it is, this Wilson-Blair media, which produces this jet back colonies in a case of typhoid or Salmonella infection. Fine. And next, you say a patient who is presented to you after an RTA. The patient presented to you after an RTA, and while pressing his limbs, you will be able to see crepitus present. Crepitus are present. So after RTA, crepitus present along with this discoloration. So ye kya? It is what it is, this typical case of gas gangrene. And we know this typical case of gas gangrene is caused by this Clostridium perfringens, because this Clostridium perfringens will be having this enzyme which is known as lecithinase, and this lecithinase will digest the tissue and causes this type of feature of this necrosis, which is known as what? Which is known as gas gangrene. Okay, and this Clostridium perfringens will show different types of reactions. Okay, next, if you see, it will produce this reaction which is known as NTR reactions. Like the first one, it is the Nagel's reactions. Next one, it is T for target hemolysis, and next one, R for, it is what it is this? R for reverse camp test. It is the reverse camp test positive. Right? So it will show this stromy fermentation of this litmus milk. So it is known as what? It is known as Naegler's reaction. Next, it produces this target hemolysis. So target hemolysis will be seen in case of Clostridium perfringens. Next, you will see this reverse camp test. So this is the usual camp test which is done for this group B streptococcus, which is what? Which is this Streptococcus agalacticae. Whereas here you will use this Clostridium perfringens to do this reverse camp test. So reverse camp test will be positive for this Clostridium perfringens. And there is one more family. Okay, one more family of Clostridium organism, which is this Clostridium difficile. Like when you complete your FMG examination के बाद आप क्या करोगे? Internship करोगे. Like if you already done your internship, that is well and good. If you do internship for the first time, then there will be two departments, the medicine department and a surgery department. And in those two departments, there will be one or two chronic patients will be there. Chronic patients will be there, and their files itself look like a FMG Solutions 9th edition book. So it will be that much big. So if you once you see on scrolling it, you will find all the antibiotics has been given to the patient, and now the patient is complaining of diarrhea. Okay, now the patient is complaining of chronic patient on antibiotic, now complaints of diarrhea. Okay, what is the diagnosis you will think of? You will think of this Clostridium difficile induced diarrhea. You will think of this Clostridium difficile induced diarrhea, and to treat this infection, you can give either oral vancomycin or you can use either oral vancomycin or fidaxomicin. So this is the formation of the pseudomembrane over this colon. So it is known as what? It is known as pseudomembranous colitis. Pseudomembranous colitis. And an HP investigation, you will be able to see the formation of this volcano eruption. So this type of volcano eruption will be seen in a case of Clostridium difficile infections, and to treat this will give fidaxomycin and oral vancomycin. तो हम ये 2 ड्रग्स देंगे, इतना याद रखो. फिर उसके बाद आगे बढ़ते Corynebacterium diphtheria. As I told you, this Corynebacterium diphtheria, it causes a condition which is known as what? Diphtheria. Okay, and this diphtheria, it will inhibit like diphtheria die. So it will inhibit this elongation factor DO. Okay, and this diphtheria will look like this appearance, which is known as what? Chinese letter pattern. Chinese letter pattern. There are different types of diphtheria. Okay, there are different types of diphtheria. One is known as fascial diphtheria, which causes this pseudomembrane presence, and there is this myocarditis, okay, which causes this circulatory failure, and but the most severe type which involves this larynx, and because of the larynx, the child is unable to breathe and leading to this death of the child. So this is this Chinese letter pattern where you will see, and when you zoom it out, you will be able to see around this end of this Chinese letter, you will be able to see there are presence of this granules. This type of granules, we'll call them as what? We'll call them as metachromatic granules, also known as volatile granules, also known as Bob's nest granules. So this type of granules will be seen in a case of Corynebacterium diphtheriae, and we know how to see this stain. So if we need to see iron, which stain we will use? So to see iron, we'll use Pearl's Persian brew. To see copper, we'll use rhodamine and ribionic acid, and to see calcium, we'll use Van Gogh stain. Likewise, to see these granules, we'll use a stain which is known as what? Albert stain, which is used to stain these metachromatic granules, are also known as Babes nest granules. Okay, and for diagnosis, we can do 2 methods. One is known as low flush serum slope. So low flush serum slope, it will provide growth. It will provide the growth within just few hours. Okay, so it is used for this earliest diagnosis. Whereas you need to confirm the diagnosis. For that, will you do this method from this potassium telluride agar. Okay, for the confirmed diagnosis, we'll use this potassium telluride agar. Fine, and we know this produces this toxin. Okay, and to detect this toxin, we'll use this test which is known as what? LX gel test. And this LX test, we'll see, we'll line up the toxin, and if it is toxin present, then it will produce this neutralization like a X. Okay, X neutralization present in the case of LX gel precipitation test. Next, we'll move on to the next part, which is this Clostridium tetani. I told you this Clostridium tetani will cause what? Will cause spasms. Will cause the spasms. And this Clostridium tetani, it will incubate this GABA or glycine. As I told you, both of them what? Both of them, they are this incubatory neurotransmitters. Okay, and it is aerobic bacteria. Okay, and it is having this terminal spherical drum shaped. Okay, drum shaped shape. Okay, remember. And as it is anaerobic, we'll use this media which is known as what? Robertson cooked meat broth. We'll use this Robertson cooked meat broth. Yeah, that is GABA and glycine. Then this can be 2, like proteolytic and saccharolytic. Means if the meat is become black, then it is a proteolytic type of Clostridium tetani. Whereas if it is turning into pink, it is what? It is this saccharolytic, which will be mostly because of this Clostridium perfringens. Okay, so this is the Clostridium tetani. And with this, we'll move on to this rickettsial infection. In a case of tetanus, you will see filtry appearance because it is anaerobic bacilli. So if you see this gelatin stab, what it will do? This is the gelatins, and the organism which is anaerobic, it will grow more on the basal side. So it will produce this pear tree appearance. Whereas if we see about this Bacillus anthrax, in the case of Bacillus anthrax, I told you it is what? It is the aerobic bacilli. So it will grow more on this side, less on here. So it will make like this. So it is known as inverted fir tree. Inverted fir tree appearance. Remember. Next we'll see about this rickettsial infections. If we see about this rickettsial infections, like it is a bit hard to remember. For this also you make a table and stick to your walls or stick to your library table, right? And this rickettsial infections, how will you remember? Like you need to remember about this disease caused and organism and the vector. Okay, so remember this epidemic, remember this LEP. Okay, remember this LEP. So epidemic typus, P for P, it is caused by this 𝗃𝗧𝗃. It is caused by this 𝗃𝗧𝗃, and louse will be the vector. So lip, louse will be the vector. Whereas this endemic, remember as fin. Okay, fin. Okay, fin. So flea will causes this endemic typhus. So flea will causes this endemic typhus, and the organism which is responsible, it is what it is, Rickettsia typhi. Okay, then the scrub typhus. Scrub. When you scrub something, you will see this sound, right? 𝗧𝗵𝗶𝘀𝗀𝗃. Okay, 𝗧𝗵𝗶𝘀𝗃. Okay, so see, the scrubbing will be producing this sound, right? So it is what it is, 𝗧𝗵𝗶𝘀𝗃, which is be responsible for this scrub typhus. Okay, and it is because of this mite. It is because of this mite. Okay, thrombocolate mite especially. It is because of this mite. Fine. Next, Rocky Mountain spotted fever. It is because of this Rickettsia rickettsii. Okay, and this too will be caused by this tick. Will be transmitted by this tick. Rocky Mountain spotted fever and Indian tick typhus. Remember, it is Indian tick typhus. So obviously it will be spread by this tick. Indians like Indian tick typhus, it is on the corners. So remember, it is Rickettsia cornei. Rickettsia conori. It is Rickettsia conori. Okay. And about this rickettsial pox, it is the acri. Acri. Acri, it is the rickettsial pox. So pox also will be caused by this mite. Next, cat scratch disease. It does not have any vector in India. So it is what it is, this Bartonella Hensley. Okay, Bartonella Hensley produces this cat scratch disease. Cat scratch disease, remember. And bacillary angiomatosis, which is mostly seen in a case of HIV positive patients. It is seen in because of Bartonella Hensley and Bartonella quintana. Bartonella Hensley and Bartonella quintana. And then Q fever. Q fever, make this C and make it into Q. Okay, it is what Q fever. It is Coxiella burnetii. तो इसीलिए इसको है वेक्टर क्यों चाहिए? So Coxiella burnetii, it is Q's fever and वेक्टर क्यों चाहिए? So there is no vector in this Coxiella burnetii. Fine. फिर उसके बाद आते हैं कि most important topics क्या? Mycology. And first in mycology, we need to know the stain. So to know this cultural characteristics, we will use this stain which is known as what? Lactophenol cotton blue. It is a cotton blue stain. So that's why the organism is what? It is blue. Whereas if you are able to see, this is this black stain. This black stain, it is what it is, the 𝗵𝗵𝗶𝗀𝗃 silver stain. So whatever organism which stains black, it is what it is, this 𝗵𝗵𝗶𝗀𝗃 silver stain. And if its stain is pink, it is the PAS stain. And in PAS, you will be able to see this type of acute angular branching. Acute angular branching, like 45 degrees. And along with this presence of the septae. So it is suggestive of which organism? It is suggestive of Aspergillus. Aspergillus. Whereas in the case of mucormycosis, you will see what? You will see this right angle branching in the case of mucormycosis. Okay, and it is not branch. This is the typical Aspergillus. Okay. Next, what is the culture? Usually, what is the culture we use for this mycologists? We'll use this culture which is known as what? Seborrhoeus dextrosarcus. We'll use this Seborrhoeus dextrosarcus for culture of this mycologic organisms. Fine. And now, and in recent years, they started testing about this 3 species: Trichophyton, Microsporum and Epidermis python. How will remember this? It is tri. So means it involves all 3 structures. Hair may be involved karega, nail may be, or skin may be. Like in a case of Microsporum, it will involve just 2 structures. Remember, it is N. L, M, N. Like you know alphabetic order, right? Like N is next to M. So it will leave nails. So it will involve hair and skin. Whereas Epidermophyton, remember it is E, A, B, C, D, E, F, G, H. So it is near to the H. So it won't involve the hair. It will involve what? It will involve what? Only nail and skin. Yeah. Trichophyton, if you are able to see, E, M, E, P, S, C. Yeah. If you see, it is what? Trichophyton, you will be able to see this like thigh. Okay, thigh. So it is what? It is the longitudinal and it is simple. It is what? It is pencil shaped. It is pencil shaped macroconidia. Okay, whereas Microspora will be having this spindle shaped. Okay, whereas Epidermophyton will be having this club shaped. Can anyone tell me where today we'll study this pencil shell cells? In which of the following conditions you will see this pencil cells in peripheral smear? You will see pencil cells in a case of anemia. In a case of iron deficiency anemia, you will see this pencil cells. Okay, fine. And we have one more classification of fungi. They are known as what? Dimorphic fungi. Next, about this dimorphic fungus means it is 2 phases. One phase at your home, one phase with your friend. Okay, so this dimorphic fungus, it will be yeast at 36 degrees Celsius and mold at 26 degrees Celsius. So remember, it is mold at cold At cold temperature, it will remain as mold. Okay. फिर उसके बाद to mnemonic is that body heat perfectly changes shape. Body heat perfectly changes shape. Okay, it is a mnemonic. Okay, so what are these organisms? It is the blastomyces, then histoplasma, P for paracoccidioidomycosis, C for coccidioidomycosis, and S for Sporotrichs and one more P for Penicillium marnifi. So there are two P. One is paracoccidioidomycosis and Penicillium marnifi. Okay, how will you diagnose? Usually, in question they will give there is a patient who is presenting with history of subcutaneous mycosis. On evaluation, the following slide has been found, and in the following slide, the fungi is to show this broad-based budding. So, agar likha broad-based budding hai, so it is what it is the blastomycosis. So, broad-based budding, it is what it is the blastomycosis. And B, you can make it as like 8. So, it's look like an 8 with a big base. Take it with a big base, it is what it is the blastomycosis. फिर उसके बाद चलते हैं histoplasma. In case of histoplasma, it will remember like a, it will be like a tuberculate microconidia. Okay, but it is to be seen in a case of lactophenol. During culture, it will see. So it will show this tuberculate microconidia. So you can know this histoplasma, right? It is also known as caves disease. Remember, histoplasma. Okay, it is also known as caves disease, also known as Ohio's disease. Caves disease, Ohio disease. As it is involved in cave, it will be spread by this bat. Okay, Ohio's disease, and it will be having this tuberculate macroconidia. So as there is this tuberculate written here, so it will mimic which disease? It will mimic TB. And if you are able to see the next condition, you are able to see this pilot veil appearance. It is seen in a case of paracoccidioidomycosis. And next coccidioidomycosis, you will be able to see this spheres and small spirals and small spores. So like it's in English, right? I guess I'm speaking in English. There's very small part where I speak other languages. Okay, mostly it will be in English. Okay, if you're unable to understand any accents, I'll be improving it. Okay, and next, if you're able to see this type of broomstick appearance, it is what it is the Penicillium marnifi. And next, if you're able to see this rosette shapes, if you're able to see this rosette shape, then if you see this rosette shape, it is seen in a case of sporotrichosis. Yeah, broomstick, like you will hit for this rat. So bamboo rat, they are what? They are this reservoir of this Penicillium marnifi and produces this red pigments. It is a sporotrichosis. Okay, and we know it spread via the lymphatic route. Fine. Next, we'll come to this mycetoma. There is this history of walking barefoot. Like there will be a what? There will be a history of this walking barefoot, and there will be a history of multiple discharging sinuses. There will be history of multiple discharging sinuses, and all of them they are classically seen in a case of mycetoma. And there are two types of mycetoma. It is most commonly seen in a case of farmers. Yeah, there will be associated pus discharge will be there, and there will be the swelling along with this sinuses discharging with the pus. It will be of two types. One is eumycetoma, another one is known as actinomycetoma. Eumycetoma means it is true. It is true like you and me. So it is the true mycetoma. So it will be caused by this fungus which is Mozzarella mycetomas. Okay, so it is will caused by this Mozzarella mycetoma. Whereas this actinomycetoma, it will be caused by this actinomyces species. It will be caused by this actinomyces species. Remember, okay? It is actinomycetoma. It is also known as a bacterial mycetoma. Okay, whereas true, it is the eumycetoma which will be caused by this fungus one. Right? Next one is the chromoblastomycosis. So if you saw a patient who is presenting with this verrucous lesions, and on evaluation, you will be able to see this sclerotic bodies, also known as copper penny bodies, also known as medlar bodies. So all of the following will be seen in a case of which condition? Will be seen in a case of chromoblastomycosis. Early presence of verrucous lesions with fungus history. Yes, fine. That is the thing you need to know about this mycology part. Next, we'll move on to this virus part. It will be a bit an easier aspect. If you see, they ask about the shapes, or they give this image, and they will ask you what is the name of this virus. Okay, if it is a filamentous, it is what it is the Ebola. Whereas rabies, it will be what? It will be bullet shaped. Pox virus, it will be brick shaped with the dumbbell nucleus. And rota, it is what? It is the wheel shaped. It is the rotating wheel. And astro, it is what? It is the star shaped. Okay, star shaped. Okay, adenovirus, if you see, it is a kind of space. Yeah, box is a box, and in a box, what you will kept? You kept the dumbbells. You kept the dumbbells, remember. Fine. Next, about the classification of viruses. There are different types of viruses based on these classifications. Based on the size, the pox virus, it is the largest one. Smallest, it is the parvovirus. Smallest is the parvovirus. And DNA viruses, usually viruses, they have either DNA or RNA. And DNA viruses, you can remember by mnemonic as HAPPY. Okay, so herpes virus, hepatitis B virus, adenovirus, parvovirus, pox virus, and papillomavirus. Parvovirus, pox virus, and papillomavirus. Okay, parvovirus, pox virus, and papillomavirus. So happy. Herpes, hepatitis B, adenovirus, parvo, pox, papova. Okay, parvo, pox, papova, and papillomavirus. All of them what? All of them they are what? They are the DNA viruses. Rest all of them they are RNA viruses. We know the DNA viruses, they will be having this double stranded DNA. Except one virus, which is this parvovirus, will be having a single stranded. Okay, usually RNA viruses, they are single stranded except virus, which has this two. Okay, all of the RNA they will be having a single strand, whereas DNA viruses, they will be having what? Double strand. So except one virus which is not having double stranded DNA, it is what? It is the parvovirus. And we know parvovirus, it is the smallest virus. Okay, then there is the envelope. Like this virus will be covered with something. If it is covered, we will call them as enveloped virus. If it is uncovered, we will call them as non-enveloped virus. So non-enveloped virus, they are not resistant to our sanitizers. Okay, sanitizers. Then it includes this two. In the case of DNA viruses, this parvovirus, adenovirus, and papilloma. This pap virus, they are naked. They are this naked virus or non-enveloped virus. Whereas RNA virus, which include Picorna, Astra, 𝗚𝗏𝐶, and 𝗵. All of these four viruses, Picorna, Astro, 𝗚𝗏𝐶, and 𝗵. Picorna, Astro, 𝗚𝗏𝐶, and 𝗵. All of these four viruses, they are this RNA viruses which are non-enveloped. DNA viruses like parvo, adeno, papova, they are non-enveloped. Whereas the rest of the viruses, they are what? They are enveloped in nature. Likewise, this double-stranded DNA will be present in all DNA viruses except parvovirus. Okay, bas itna yaad rakhna. Then we'll move on to this intracellular and intranuclear inclusions. Intranuclear inclusions, we'll see two bodies, 𝗓𝗏𝐴 and 𝗓𝗓𝐵. Means this is 𝗓𝗓𝐴, means which is basophilic, which is blue in color. It is what it is, 𝗓𝗓𝐵. Whereas which is more or less blue or less pink in around the pink in color, it is what it is, the 𝗓𝗓𝐴 bodies. Remember, this 𝗓𝗓𝐴 will be seen in a case of herpes virus and yellow fever virus. Whereas 𝗓𝗓𝐵 will be seen in a case of adenovirus and poliovirus. Adeno and polio will show this 𝗓𝗓𝐵 type of viruses. And there is this intracytoplasmic, inside the cytoplasm, you are able to see this type of fillings. It will be seen in a case of few conditions like rabies. Rabies, you will see this Negri bodies. Rabies, you will see Negri bodies. Next, this Anderson-Peterson bodies. Anderson-Peterson bodies will be seen in a case of molluscum contagiosum. In molluscum contagiosum, you will see this HP bodies. Yeah, Negri bodies we'll do autopsy, and we'll see in a case of rabies. Okay, remember. Next, only few conditions which will show both intranuclear and intracytoplasmic inclusions. Likewise, as I told you to morning, it is this outline. If it is blue, it is क्या? Blue, it is the CMV1. अगर blue है तो CMV1. Red one, Reed-Sternberg cell. Red Reed-Sternberg cell. Reed-Sternberg cell seen in a case of Hodgkin's lymphoma. Whereas the CM will show this central bluing. Okay, central bluing. It is what it is, this intranuclear inclusions in CMV. Whereas it will be having both intranuclear and intracytoplasmic inclusions. Fine. तो उसके बाद आगे बढ़ते हैं मीजल्स. मीजल्स में भी हमें both intracytoplasmic and intranucleus मिलता है. फिर about this classification of this viruses, the classification हमें क्या देखेंगे? We need to see what are the types of viruses based on this herpes virus. This human herpes family, it is divided into 8 classes. HSU1, it is this herpes simplex 1. So herpes simplex 1, remember, it is the first. So initially what you will do, you will start with your lips. Okay, you will start with the upper part of the body. So remember, it is above the waist. So HSV1, it involves the lips are above the waist. So it involves the herpes labialis and encephalitis. It will cause herpes labialis and encephalitis, temporal lobe encephalitis. Whereas this HHV2, it is a very ganda one. It involves what? It involves this below the waist, which will cause this genital herpes. So in a case of genital herpes, if you do a Zank smear, I showed in pathology, if you do a Zank smear, you will able to see this multinucleated giant cells in a case of HSV, remember, okay? Yeah, below waist, waist matlab around the hip, okay? And human herpes virus 3, remember this 3? It is what? It is our famous chickenpox, okay? Chickenpox, which is this varicella zoster virus, and it will be having this pleomorphic rash. It will be having this pleomorphic rash, and this can remain dormant. Into the ganglia, and it can reoccur in old age or immunocompromised state. So this is what? This is known as shingles, and shingles, it will cause a post-herpetic neuralgia. And answer me, it is a pharma questions. In a case of post-herpetic neuralgia, what is the drug you will use? You will use this gabapentin. Fine, you will use this gabapentin. Okay, yaad rakho. Next, if you see this human herpes virus 4, fourth virus kya? It is the Epstein-Barr virus. It is the Epstein-Barr virus, and we study this Epstein-Barr virus. It will cause a disease, which is what? Which is this infectious mononucleosis. Okay, and this infectious mononucleosis will be caused by this involvement of the CD21 receptor, and because of this, it can even cause carcinogenesis. So remember, this HHV4, which is the Epstein-Barr virus, it will be having the involvement of CD21. It is very, very important. Okay. This HHV5, it is the cytomegalovirus. Because this cytomegalovirus, it will spread via this congenital route, and it also causes this CMV retinitis. Next, HHV6. It causes this. This is which is known as roseola infantum. Roseola infantum causing this slab cheek appearance. Okay. And HHV8, it causes this Kaposi's sarcoma. Kaposi's sarcoma, it will be caused by this HSV8, HV8, okay, which is mostly seen in a case of HIV positive patients. So remember, HHV1, it is the herpes simplex type 1. HSV2, it is the herpes 2, okay, it is the herpes simplex 2. HHV3, it is the chickenpox, which will be showing this pleomorphic rash. Pleomorphic means different types of rash or different stages of rash at the same time, okay, and it is associated with the itching, and if it resolves, if it happens and in older age as a dormant condition, okay, it is what? It is known as shingles, okay. And HHV4, HHV4, it is what? It is the EBV, whereas HHV5, it is the cytomegalovirus. HHV6, it is the roseola infantum, whereas HHV8, it is what? It is this Kaposi's sarcoma virus. Fine. And next, if you see about this eggs and larva, if you see this type of eggs, which is having this 4 flagellas, it is what? It is this Giardia. It is a Giardia. And remember, the Giardia will be having this falling leaf motility. So remember, Giardia gyradia. So it will be having this, Giardia will be having this falling leaf motility, and it will be having this suckling disc. Okay, it will be having this suckling disc here, okay, with 4 pairs of flagella. And if you are able to see this type of hair, like if you see this girl, right, they will be having this curly hairs on the side, okay, on the side. So it is what? It is the trichomonas. So if it is like a hair, like a curly hair, it is the trichomonas vaginalis. And we know trichomonas will produce, okay, trichomonas vaginalis, it will be having this hair like one, okay, it will be what? It is the trichomoniasis. Next, if you are able to see this type of sharpened ones, it is what? It is the acanthamoeba. That is the acanthamoeba. It is the acanthamoeba. Yeah, we'll use this diamond media for this trichomoniasis. This acanthamoeba, it is most common cause of corneal ulcer in the case of contact lens users who washes this contact lens in the running tap water. Fine. And about few eggs we'll check. We see about this eggs having this barrel shaped eggs, which having this opening, which is known as what? Which is known as operculated eggs, which is most commonly seen in a case of all cases of trematodes, okay, and the cystodes, except the schistosomiasis. In schistosomiasis, will give or will see this spine, okay, spine will see in a case of schistosomiasis, and in Manzoni, and in mans you will see this lateral spine. Only the mans will come on back pitch, right? Not animals, they will come on back pitch. So mans, they will come on back pitch. So remember, it is the lateral spine which is seen in a case of Manzoni, okay, whereas this central one will be seen in a case of hematobium. So schistosoma hematobium will be having this central spine, and whereas this japonicum will be having this knobs, will be having this small one, which is this rudimentary spine, which is seen in a case of schistosoma japonicum. And next, if you are able to see this type of hooklets along with this polar knobs and this polar filaments. So if you see, as this nana nani means this in old age, if you see the old age nana nanis, they will be wearing this specs, okay, and most of them they will be alone, they will be separate, okay. So this Haemophilus, like no, this 𝗏 nana, this will be having only one host. So initially in their young they will be like this, but on later on ages they will be bent like this. So it is known as what? It is also known as dwarf tapeworm. It is known as dwarf tapeworm, okay. As like this two pecs, they will be having this polar knobs. They will be having the polar knobs, and we know they will be having this vision difficulty. So they will be having this chesma, and it will be tied with a rope. So once you tied with a rope, it will be like a polar filaments and polar filaments, okay. And they will be having the hooks. They will be having this hooks. So it will be having the central hooks along with this polar filaments and polar knobs, okay. This, if you ask me, it is for a supplementation or is for final part of revision. This session along with this PYQ, it is more than enough, okay, as a final point of revision, and you want exactly 150 score, and you can attempt or you can read each line by line everything, and you can get questions from it correct, then it is more than enough. But if you already studied with your main notes, make sure you are reading your main notes and making this as your supplement or extra edge, and make sure you are reading this in the final part of your revision. So this is how you will improve the scores, and you will get 150 marks for sure, okay. But if you read this only, you will cross this 150 mark, but you make sure you are reading each and every part, okay. That is the thing. Then if you see this Enterobius vermicularis, if you see this Enterobius vermicularis, if you see, this is known as what? This is known as pinworm. This Enterobius vermicularis, it will be having this plano-convex egg along with this larva inside. It is seen in a case of Enterobius vermicularis. Next, Trichuris trichura, if you see, it is like a barrel-shaped egg along with this mucus plug. Okay, it is seen in a case of Trichuris trichura. Yeah, you will see this thing which is known as what? Coconut cake rectum. You will see this coconut cake rectum and also rectal prolapse in a case of Trichuris trichura. Okay, and next, this is the only ciliated protozoa. It is what? It is the Ballontidium coli. So Ballontidium coli, it is the only ciliated protozoa. You can see, right, the cilias. Okay, and it will be having the binucleated. It will be having the two nucleus, one big one and one other small one. So Ballontidium coli, it will be having the binucleated. Okay, then if you see this kind of segregations, okay, segregations inside the egg, it will be seen in a case of blastomeres. We'll call it as, will be seen in a case of ankylostoma duodenale. And next, in a case of ascariasis, there will be two eggs. Like ascariasis, if you see this type of rugged eggs or rough eggs, will be seen in a case of unfertilized ascariatic eggs, whereas in a case of smooth edge, will be seen in a case of fertilized ascariasis eggs. So most of this image of this thing will be asked from this part only. Okay, make sure you are reading it or taking it correctly. And about the malaria, you need to know about just few things. In the case of Plasmodium, you know the infective stage. In the case of infective stage, it is in man, it is what it is sporocytes, whereas for mosquito it is the gametocyte. So in man, if you see this type of banana-shaped gametocytes, will be seen in a case of Plasmodium falciparum. And in Plasmodium falciparum, you will see this multiple rings. It is not single rings, it is multiple rings will be seen in a case of Plasmodium falciparum. Okay, and there are few additional dots you will see here. In the case of vivax, in viva they will shuffle and ask. So you will see this Schaffner's dots. Next, in the case of falciparum, remember it is, read from here, it is the Murier's dots. And in malaria, you will see the Zeeman's dots. Malaria, you will see Zeeman's dots. Vivax, you will see this Schaffner's dots. Falciparum, you will see this Murier's dots. And vowel, you will see this James dots. Okay, so let's read and remember these dots for one more time you will be able to get this thing. And in the case of 𝗵𝗵𝗶, it is not multiple rings, it is the only one ring. Okay, and here there is, you can see this kind of diffused gametocytes, whereas in the case of Plasmodium you will see this banana shaped gametocyte in the case of Plasmodium falciparum. Okay, and finally if you are able to see this type of Maltese cross appearance, where you will see this Maltese cross appearance, guys? In RBC, in which infection you will see this Maltese cross appearance? You will see in a case of, which is babesiosis. You will see in a case of babesiosis. Good, guys. We will see in a case of babesiosis. Good, Dr. Naresh. Then about this last slide, if you see, you need to differentiate between this type of organisms. Okay, like if you see these forms, there is a presence of this sheath. Here there will be WBL like or LBW. Here there will be presence of sheath will be present here. There will be presence of sheath. Okay, but in a case of rest organisms, the sheath will be absent. Okay, you can see, right, there is no outer covering. The sheath will be absent. Okay, and now they will ask you which of the following organism is this based on their nuclei count. Okay, if you see there is no nuclei, there is no nuclei. If there is no nuclei, Bancrofti means there is no nuclei, it is Bancrofti. Okay, then if you see this Malai, okay, if you see this Malai, Brugia Malai, it is what? It is the Brugia Malai. So B for B, it will be having this 2 nuclei at the tip. So if it is 2 nuclei at the tip, it is what? It is the Brugia Malai. Whereas if you are able to see the nucleus persisting till the end, but it is in a line. So if it is nucleus in line, then it is known as 𝗲𝗲. The nucleus in line, it is 𝗲𝗲, whereas no nuclei, it is what? Escherichia Bancrofti, whereas Brugia Malai, you will see 2 nuclei, and all of this 3 will be having this sheath. Okay, there will be the presence of the sheaths, whereas rest they won't have the sheaths. So if you see here, if there is no nuclei going till the tip of tail, what do you think of? Which organism is this? No nuclei at the tip, and there is a presence of this sheath. What is this organism? It is what? It is the Escherichia Bancrofti. It is the Escherichia Bancrofti. And final part, we'll discuss this and we'll leave off. Fine. If you see this one, this organism, this is responsible for diarrhea in HIV positive patients. HIV positive patients. Yeah. This previous conditions, previously this Escherichia Bancrofti will cause what? Lymphatic filariasis. Okay. Here this diarrhea in HIV positive patients will be caused by this Cryptosporidium, Cyclospora and Isospora. But you need to differentiate. How will you differentiate this organism? Remember, this is crypto, means it is very small. So remember, it is very small. So it will be around 4 to 8 micron, okay, in diameter. Whereas this Cyclospora, it will be having this 8 to 10. It is the next line. It is double of it. So it is the 8 to 10. Whereas this Isospora, draw this iso. So it will be what? It will be oval in shape. It will be oval in shape. It won't be spherical. And then you can use one more method, which is what? Which is this acid fast staining. Acid fast staining. And in acid fast staining, if you see Cryptosporidium, it will stain perfectly. Whereas it is Cyclospora, it will be cyclical in nature. It will stain sometimes, it won't stain sometimes. So it is what? It is known as variable acid fast. Variable acid fast. Whereas Isospora we can identify based on this oval shape. So guys, that's it. That's it. You need to remember about this Cryptosporidium, Cyclospora part, and that these are the most must know and most important topics from this microbiology perspective. Just remember one thing: if you study hard and stay motivated for this all along journey of next 40 days, then you can crack this examination for sure. Okay, just try to get your motivations from inside. Don't seek for external motivations, because external motivations, they will stay for only a while. Okay guys, like that's it for this microbiology part. We'll have a good lunch break for 40 to 45 minutes. It is 2 o'clock exactly. We'll meet up at 2:45 p.m. Okay, we'll meet up at 2:45 p.m. Okay, that's it. If you have any doubts, I'll clear it off. Okay, fine. Yeah. Bye bye guys.